Welcome to Health Recovery, a place where you can truly understand your body and gradually reclaim your health through natural, safe, and strategic approaches. Do you or someone you love live with diabetes or kidney disease? If so, caution is key because certain everyday medications might be silently damaging your kidneys and making your condition worse without you even realizing it. In this video, I'm going to share with you 9 common medications that people with diabetes and kidney issues should avoid, along with safer alternatives, including natural remedies that support healing. If you find this information helpful, don't forget to like this video, subscribe to Health Recovery, and hit the notification bell so you never miss out on life-changing health insights. 1. NSAIDs, non-steroidal anti-inflammatory drugs. These are among the most commonly used pain relievers, including ibuprofen, naproxen, found in Advil, Aleve, and other over-the-counter anti-inflammatory drugs. People with diabetes often experience joint and muscle pain or inflammation, which leads them to use NSAIDs for relief. However, if you have kidney disease, NSAID can reduce blood flow to your kidneys, impairing their filtering ability. Source: kidney.org. Long-term use of NSAIDs can cause permanent kidney damage and even acute kidney failure, especially when taken while dehydrated or with low blood pressure. Source: NIDK, NIH.gov. Tip: avoid NSAIDs if you have kidney disease. Ask your doctor about safer pain management options. 2. Nephrotoxic antibiotics. Certain antibiotics used to treat severe infections can be toxic to the kidneys, especially aminoglycosides, e.g., gentamicin, tobramycin, and vancomycin. These are typically used in hospitals to treat serious infections, but can harm kidney cells during drug elimination. Source: PMC, NCBI, NLM, and IH.gov. People with diabetes and kidney problems are at higher risk because their kidneys can't eliminate these drugs efficiently. Always inform your doctor about any kidney condition before taking antibiotics. Safer alternatives or dose adjustments may be necessary. Source: kidney.org. Stay hydrated when on antibiotics, unless advised otherwise. 3. ACE inhibitors and ARBSC inhibitors, e.g., lisinopril, perindopril, and ARBs, e.g., losartan, telmisartan, are blood pressure medications commonly prescribed to protect kidneys in diabetes. Though they are beneficial when used correctly, problems arise if taken inappropriately or without proper monitoring. These drugs dilate blood vessels in the kidneys, which can temporarily reduce kidney function and increase creatinine. In those with advanced kidney disease, this reduced blood flow can trigger acute kidney failure, especially when combined with NSAIDs or diuretics, the triple whammy. Source: GoodRx.com. Stick to your doctor's instructions and get regular blood tests to monitor creatinine and potassium levels. Ask your doctor if you should pause these meds during illness, fever, or dehydration to avoid additional strain on your kidneys. 4. Diuretics, water pills. Diuretics like furosemide, Lasix, and hydrochlorothiazide are often prescribed to diabetic patients with high blood pressure or swelling. They help your body excrete salt and water, which relieves swelling and controls blood pressure. However, high doses or combining diuretics can lead to severe dehydration, reducing blood flow to the kidneys and causing prerenal acute kidney injury. These medications can also disrupt your body's electrolyte balance, which indirectly harms kidney function. Source: GoodRx.com. Use diuretics strictly as prescribed. Don't increase the dose on your own. Drink enough water, as advised by your doctor. and keep up with follow-ups to check your kidney function and electrolytes. 5. PPIs and acid-reducing medications. Proton pump inhibitors, PPIs, like omeprazole, lansoprazole, and esomeprazole are widely used to reduce stomach acid. Many people with diabetes use them to prevent ulcers or treat acid reflux. However, long-term use of PPIs has been linked to a higher risk of chronic kidney disease. Source: kidney.org. Though the exact mechanism isn't clear, PPIs may cause interstitial nephritis in sensitive individuals. Other antacids containing aluminum or magnesium can also be risky if your kidneys are impaired, as they struggle to eliminate these minerals. Talk to your doctor about minimizing or safely stopping PPIs, especially if you've been using them long-term. 6. Certain diabetes medications. Some diabetes drugs require dose adjustments in kidney disease to avoid harmful buildup. For example, metformin is usually the first-line treatment for type 2 diabetes, but in advanced kidney disease, it can accumulate and trigger lactic acidosis, a serious condition. Likewise, sulfonylureas, e.g., glyburide, glipizide, can cause prolonged low blood sugar in patients with reduced kidney function. Insulin needs also change, as kidneys help metabolize insulin. Your doctor should adjust your meds based on your eGFR. Never continue your usual diabetes medication without reevaluation after a diagnosis of kidney impairment. 7. Contrast dye for imaging tests. People with diabetes often need imaging tests like CT scans or MRIs to monitor complications. These tests sometimes involve contrast dyes containing iodide, CT, or gadolinium, MRI. In patients with kidney disease, iodinated contrast can cause contrast-induced nephropathy, and gadolinium can rarely cause nephrogenic systemic fibrosis. These risks are significantly higher in diabetic patients with kidney impairment. Source: emedicine.medscape.com. Always tell your healthcare provider if you have kidney issues before imaging. Ask if non-contrast alternatives, ultrasound, MRI without contrast, are available. When contrast is necessary, doctors may give 4 fluids to protect your kidneys. 8. Herbal and over-the-counter supplements. Natural doesn't always mean safe. Certain herbs, like those containing aristolochic acid, e.g., Aristolochia species, have been linked to severe kidney damage. Source: pmc.ncbi and lm.nih.gov. These can cause irreversible scarring and kidney failure. Even some supplements with high doses of vitamin C or protein can stress your kidneys. Be cautious with miracle cures and unregulated health products. Always talk to your doctor before taking any herbal remedies or dietary supplements. Your kidneys don't care if something is natural. They only react to toxicity. 9. Mood stabilizers like lithium. Lithium is prescribed for bipolar disorder and other mood-related conditions. Though effective, long-term use can impair the kidney's ability to concentrate urine, causing nephrogenic diabetes insipidus, not to be confused with diabetes mellitus. Over time, lithium can lead to chronic kidney disease due to cumulative damage. The risk increases if lithium levels in the blood are too high or if kidney function is already reduced. Source: kidney.org. If you or a loved one takes lithium, ensure regular kidney function monitoring and talk with both your nephrologist and psychiatrist to manage dosage and alternatives when needed. You see, medications are a double-edged sword. They can heal, but when used incorrectly, they can harm, especially for those with diabetes or kidney disease. Remember, you are your strongest advocate. Learn what you're putting into your body. Ask your doctor questions. Explore natural alternatives where possible. And don't forget to like this video, subscribe to Health Recovery, and hit the bell so we can walk with you on your journey to vibrant, informed, and empowered health. Health Recovery, healing with knowledge, thriving with compassion.